This is Dr. Meyer with another message this week. We've covered choosing your doctor when doctors are the problem, choosing your own personal physician. Today let me talk about the patient who says, "Doctor, let me die." That's going to be a new thing in the field of healthcare, and doctors are kind of inclined to do everything possible in heroic things, even in hopeless situations. And recently I was covering for a colleague who had me see his patients, and I was covering, he had 3 patients he wanted me to see. One had cancer that spread throughout the body, one had a stroke and couldn't swallow, and he had to be fed through a tube in his stomach, and the third one was so senile that she was unable to know who her family was or what year or date this was, and was totally disorganized in her thinking. And I asked, why are we making these no code? He says, every one of those should be resuscitated if their heart stopped. And I asked why. He says, because the family wanted them to be resuscitated should anything happen. But I says, as doctors, don't we make the decision when to treat, when not to treat? And if there's nothing to treat and the next stage in this illness is dying, the heart stopping, isn't that a blessing? He says, no, we wanted everything done. And so we've gotten ourselves into this bind of doing everything, and as you know, Medicare says about half of their expenses are in the last 6 months of a person's life, and that is unfortunate. If you watch the obituaries, you'll notice that more and more people are dying at home. 20 or 30 years ago, everybody was dying in the hospitals. Now they know that you die with a bunch of tubes and you can't even get close to your loved ones in the hospital. And that's why patients have gotten to this point saying, "Doctor, let me die without all those tubes." I think one example was Mrs. Kennedy. When she had her leukemia and things became hopeless, then she wished her doctors goodbye and went home to spend her remainder of her time with her nurse. And actually in the final years of her life, that's really all you need. The doctors no longer would be relevant to her. They've done everything they could, and so now it's a matter of comfort for the last few months or even years of your life. The physician is committed to saving your life, but give them the option when things are hopeless and not to extend the discomfort any longer than necessary. Your county medical society can give you help in your durable power of attorney, because it's very important to put this in writing and that your doctor has a copy of this. Many of my patients come in and say, here's my durable power of attorney, and when things get hopeless, I want you to make the decision. And he says, what if your family disagrees? He says, well, I want you to make the decision, because my family will always want everything done. And that's very true. We see people coming in that hadn't seen the person that's dying for maybe the last year or two, feels very guilty, and so they will do everything they can to force you to keep them alive through a hopeless situation. So we're seeing more and more of this business of, "Doctor, let me die." And that's it for this week, and we look forward to talking to you again in the near future.